Hello, and thank you for joining this session where we'll be hearing about the breadth of the term care team and sharing insight on how people can best make contact with the right healthcare professional and make the most of that relationship. I'm your host, Becky Port, Research Communications Manager at Parkinson's UK, and I'm delighted to be joined by Caroline BARTLIFF, who's a specialist speech and language therapist at Derbyshire Community Health Services, Sue Whipps, who's a Parkinson's UK volunteer and a care partner, John Whipps, who has Parkinson's and is a PPI enthusiast, and Catherine French, who is a Service Involvement Programme Manager at the UK Parkinson's Excellent Network. So I'm really looking forward to the discussion and hearing more from Caroline, opening the floor to a lot of questions. And if you want to watch this session again or have any technical issues, don't worry, we'll have the session online available to watch for 30 days after the event. So without further ado, we'll kick off and hand over to Caroline. Good morning.
Thank you, Becky, and thanks for asking me to speak on behalf of speech therapy and the team here in Derby. We've got a large care team here. We have specialist physios, occupational therapists, dietitians, staff nurses. We've got different types of consultants. We've got geriatricians, we've got neurologists, palliative care consultants and psychiatrists. We've got the wider team as well, continence nurses, clinical psychologists, pharmacists, respite care, social services, carers. So there's a lot of this, and I strongly believe that the key to managing Parkinson's is with the whole team. We listen to the concerns of the individual, but we want to offer holistic care. And that's tailoring the right advice. We want you to know when to come to us, what the symptoms are. Here in Derby, we're one of 2 centres of excellence in the UK, one being King's College London and obviously ourselves here in Derby. We offer Parkinson's education groups. They're courses run by different professionals in the team. So 4 to 6 weeks, they might talk about bed transfers, they might talk about bladder and bowel issues, benefits, services by local groups, speech therapy. There will be these education courses at different places around the country. There are a lot of therapists that even if they aren't a specialist centre, they have an interest in Parkinson's. So, you know, if you wanted to try and access a service like this, I would start with your consultant or your Parkinson's nurse and ask them if they can refer you to a specialist team. So what are those symptoms that people might need help with? I'm going to give you an imaginary person. Her name's Jane, and she's come to clinic. She may have been diagnosed about a year ago and noticed that people are asking her to repeat a lot. She doesn't think her voice has particularly changed, but she's been told that she's mumbling, and she thinks her partner might be going a bit deaf. Her swallowing hasn't really changed, but meals are taking longer and therefore the food's going cold and it's less appetizing. She thinks she may have lost a little bit of weight. She may mention about her drooling, that's happening occasionally, happened a few times when she's been out. It's been a bit embarrassing. That's causing her to go out less with people because she doesn't want to be seen doing that. When I talk to her about how she feels about the impact of her symptoms, she may tell me that she's tired all the time, has lots of thoughts running through her head, she isn't sleeping great, she may get off to sleep okay, but is waking frequently in the night, and then that's having a knock-on effect to a bit of fatigue the next day. She may not have had any falls, but a couple of near stumbles or near misses, and she thinks her balance isn't as good as it used to be. So if we pick up on some of those things that she may have shared with us, and we start with voice, the mumbling of speech, well, we definitely advise her to see a speech therapist as early as possible. Get some proactive strategies in place. Ideally, go to a centre where they can give you audio or visual feedback. Maybe a centre that offers the Lee Silverman voice therapy. That's an intensive voice therapy, which is aimed at getting carryover of a louder voice, clearer speech into your everyday talking. But we want in speech therapy to be looking at airflow, voice projection, and you noticing that your voice has changed, noticing that your voice is dropping. Thinking about those symptoms of balance, maybe posture, falling, possible freezing. Well, we definitely want a referral to the physiotherapist for that. Thinking about sleep hygiene, lots of different reasons why people can have their sleep affected. A good starting point is the occupational therapist. They can look at mood, thinking skills and memory as well. It could be that sleep is affected by waking in the night to need to go to the toilet. So we might ask the staff nurse or a continence nurse to give some advice about that. When we talk about how you're feeling, mood, and particularly apathy, that can make it difficult to motivate yourself to do the exercises and be proactive. So, getting yourself that routine where you do it without having to think about it, or maybe even a buddy system, those kind of things can help. Fatigue is a big challenge because everything that you do maybe takes more energy. You have to think through and plan more the movements that you do. So it's just acknowledging that fatigue and managing your fatigue. Thinking about the weight loss because food was less appetizing. Well, we could be looking at asking the occupational therapist about equipment, perhaps utensils or hot plates. But we could also perhaps think about the dietitian. They tend to have a food first philosophy. So fortifying food, having more frequent snacks, or if it's the drooling that's concerning somebody, thinking about, well, why is that drooling happening? And it's mostly happening because posture might rest forward and lip seal might not be, might be allowing that saliva to come out one side or the other. So we can look at posture, lip seal exercises. We could look at swallow retraining, reminding you to swallow more frequently. We might look at medications to dry your mouth out a little bit. So you could speak to a nurse about the options for drooling management, a speech therapist or your doctor. We're big believers in compassion-focused therapy. It helps promote well-being and encourages self-compassion, but also compassion for others. And it's a really useful model to think about self-management. So if we think about a threat and a symptom that comes along, our bodies can perceive as a threat. It might trigger an emotional response. And when we have adrenaline coursing through our body, it can make us feel a bit sick. We could label that as a bit of anxiety, feeling a bit anxious. And when we feel an uncomfortable feeling like that, we have two options. We could soothe our mind and body, so doing things that feel calming, relaxing and comforting. Or we could opt to distract ourselves and use the drive system by being proactive and doing things that stimulate, like listening to rock music or dancing or doing singing or doing those high intensity exercises that you've been recommended. So an example of that model in speech therapy terms, if somebody comes to clinic and they are concerned about their voice, it's making them feel angry and frustrated. Every interaction might trigger them and that emotion. So we're thinking, if stress is having an impact on them, what can they do? What do they find soothing or relaxing or calming? Is it relaxed breathing or progressive muscle relaxation or mindfulness or listening to some music that they find calming and relaxing? Because talking is harder if your adrenaline is coursing around your body. Access to language gets harder. So we need to then soothe the system to then get to a point where talking is easier. It could be, though, that people want to kickstart that drive system, want to do some voice projection exercises, want to do some singing or things that will help distract them from that feeling that they have. So when do you need to ask for help? Some people want to be proactive. They want to gain knowledge about the condition. So they might be really keen to attend singing groups, and there's online groups that are happening, coffee mornings, maybe knit and natter, Parkinson's local branch meetings, going on walks, or community groups like the Tai Chi, Qigong, the high intensity training groups. But we don't want people to feel guilty that you should be doing X, Y, Z in order to be managing your Parkinson's. Joining groups isn't for everybody, and there are lots of opportunities for other things out there. So, for example, there are befriending schemes. If you feel your sleep or mood is affected, you could reach out to the occupational therapist, or maybe even apply for some talking therapy. If you wanted to do some physical exercise or look at balance, you could. YouTube have some great resources out there now. I'm part of the Parkinson's East Midlands Research Network. They have a website. If you Google PEMRIG and their healthy living page, they've got some links to resources on there. You might even want to do a bit of voice projection exercises, and examples of that could be creating a video log of yourself, talking about your own life story, or using gadgets like the Alexa for some voice projection work. If Alexa or the Echo can hear you, then you might be loud enough. There are lots of other gadgets that we can look at in clinic and recommend for you if you're interested. So say, for example, there are iPad apps out there that can give you feedback about the loudness of your voice. There's a high volt bracelet which can illuminate to tell you if you're loud enough. And there's a respiratory therapy that we can do that improves voice quality and can help with swallowing, and that's called expiratory muscle strength training. So there are lots of ways that we can support you, both within speech therapy and the wider team. So how do you get a referral to us? Well, I would definitely start by asking your consultant or your Parkinson's nurse specialist. They should know the main centres that you could access. There are some places where you might be able to access yourself without having a referral by a doctor or a specialist nurse. But I think in the first instance, go to your consultant or your Parkinson's nurse, and they should be able to advise you. Okay, thanks.
Thank you so much, Caroline, for that amazing overview of all the services out there. And it's clear that there are so many opportunities for people to take control of their condition and find help that they need. I'm glad to invite everyone back into the room now, and we're going to open the floor to have a discussion about care teams and the relationships that we have with them. And I'd love to go to you first, John. Can you tell me about your experiences developing a relationship with your care team?
I think for me, I was very interested in research anyway, because that was part of my career. When I got Parkinson's, I was a bit stunned, but Parkinson's UK were useful, and so were my professionals that I dealt with initially. And the more I actually saw my professional team, the more I actually got involved myself. So, for example, first of all, I just went along and saw a consultant, yes, okay, how's it going? These are sorts of things. Ended up with some tablets, and off we went. But gradually, I needed to do more studying of what there was around Sue, and I got very interested in research. So we had one area of us which was all about research, and research hinged on what we actually, what we did for our own benefit. And that came down from seeing the consultants, finding out what was available, and getting referred, just the way that Caroline had mentioned. But it's not always as easy as that, because there's always shortages of staff. And so there was, get referred to a physiotherapist, great. And then when? I was very lucky to get the voice training, Lee Silverman. And I'm need booting, because I'm doing exactly the same as you mentioned yourself. I'm not doing the practicing. It's the emphasis, seeing people regularly about that, to say, well, how's it going? the follow-up is really important as well, because these are sorts of things you need. So I was very lucky. I got Sue, and between us, we went along and asked what's available. And when we took everything that we could, because you never know when it's going to be useful. And it's true, some things seem completely irrelevant initially, drooling, those sorts of things. That's never going to happen to me. But these things sneak up. As you actually get older, they do. So it's useful to get information quickly and when you want it too. Yeah. I've rabbited on, so that's a lot.
But we've lived in two areas, and first of all in the Midlands, apart from when John was first diagnosed and then he was told he wasn't bad enough for a Parkinson's nurse, which we then discovered was completely the wrong thing. We lived down in the southwest, also in the Midlands. We were given quite a lot of help, neurophysiotherapy, Lee Silverman, but gradually all those services were withdrawn, not because John had qualified, but because the funding wasn't there. Then we moved to the southwest and you had to ask for everything. And it's like unknown unknowns. Unless you know there's a physiotherapy service and somebody dealing with Parkinson's, you wouldn't know to ask. And we made a point in our support groups that we ran to push that, really, to say, get help. Otherwise, it's almost as though it's not offered to you until the problem becomes acute.
Yeah, I mean, I think Sue and John, you've raised some really good points there about, because thinking about the wider care team, your actual care team is really massive, and there's probably lots of people within that team. You think of like, oh, I've got my consultant, my nurse, therapists, but actually there's people like yourself, Sue, as the caregiver. There's potentially mental health teams, continence teams, the actual team. And I think you raise a really good point there of ask. Don't ever be afraid to kind of, if you've got something you're not sure, or you're not sure about who is the person that I need that can help me, ask that question, because I think that's the biggest challenge around. It's the unknown of, well, who is the care team? And actually the care team is, I would hate to try and write it down on a piece of paper, because the list would probably never end, if I'm honest. I don't know, Caroline, kind of, you probably have some experience as well of that.
How do you get them? That's the key thing. You need to know who these people are, what they can do for you. And unless someone recommends you, you're going to live in a black hole. That's my experience with a range of consultants and Parkinson's nurses. And they're surprised you don't know.
Yeah.
You don't know unless someone tells you.
I think there's a lot of geographical variability as well, though, as you've described, Sue. And services move around. So even if 10 years ago there was a department somewhere, it doesn't mean that they're still in that physical location. And, phone numbers change, NHS trusts shift, different people take over the contract. So that makes it harder for you to access your services too. I think if you've got a consultant with a specialist interest in Parkinson's, they do tend to know, and obviously Parkinson's nurse specialists do as well. But then, as you've described, it can be difficult to get through to people to ask. And if you're seeing somebody like once a year, or then that makes it hard. So the local groups, I think Parkinson's UK have got a key role here. I mean, I was thinking there's the Parkinson's National Audit services every 2 years who are interested in Parkinson's complete that national audit. Therapy audit, speech therapy, physio, occupational therapy, nursing, Parkinson's nurses audit. That would tell you which services around the country have a special interest in Parkinson's. If there's a way of accessing which services have done that, then actually we could build that picture of what there is nationally.
That would be ideal.
Yeah. Yeah. I mean, I think the other thing that we really, particularly Parkinson's UK, really wanting to strive for is that access to that multidisciplinary team. And I know in Derby, people are so lucky because the service in Derby is absolutely amazing, and it's something that we're working really hard, because one of the kind of, I think this comes back to Sue and John, what you're saying, you kind of don't know what you don't know, but actually if people have access to that multidisciplinary team, it may be that they know to contact somebody, but it may not be the exactly right person. But because there's a team and they all talk and they communicate and they all know about you, it's sometimes easier to navigate that, sometimes what feels like a minefield. I don't know if that's kind of the right analogy to use, but actually if you were to say, for example, phone Caroline, but it's actually not a speech and language therapy issue, but Caroline will know who in the team, and that team will have a really great knowledge. So I think part of when we talk about a care team is talking about that kind of multidisciplinary team where the team all works together, they meet together, they know their patient group, and you can actually get to the right person at the right time for what is your current kind of concern and challenge. And that, for me, if we can get that, that's kind of what I'm really striving that everybody gets a Derby team.
Is it possible to ask for help or contact outside your area? So if sounds a wonderful place to visit, Derby, for one reason or the other, but can you get referred to, or just go and see people, that sort of thing? I don't know how open this is. I was completely unaware of it. I didn't know Derby existed.
Yeah. I think it depends on the referral criteria for the service. I mean, in Derby, we do have people from all over the East Midlands. I mean, we've had people come down from Manchester, we've had people from Uttoxeter way, sometimes people might come from Nottinghamshire, but I mean there are services in those local areas too, and so, you know, I think it's about having a chat with the individual, isn't it, and what works best for the individual. If somebody can do remote therapy, that's going to help, but that we don't want to duplicate services as well, and there is some very good work happening in other centres where those therapists are building their teams. So I think it's just the conversation to start with, isn't it? It's you know, who offers Lee Silverman voice therapy, and that will tell you a little bit about your specialist service for speech therapy particularly. I really like Catherine's thought there about linking. So you go to see a physio, that physio should know the team around them, and be able to link you through to the services that way.
I don't think COVID has helped a lot, because people have felt abandoned, whether they are or not, having to be locked down and possibly not very au fait with video consultations. That's made a lot of people very stressed. And I'm coming across people who are still anxious about going through the front door. They're actually scared of catching COVID because there was such a big push on keeping safe, even though they're vaccinated. And who's to say that's the wrong thing for them to do? But the services are inaccessible because of the stress levels.
I mean, I think you raised some really good points there, Sue. I mean, we know there was a massive impact on Parkinson's services through COVID. A lot of that was due to staff redeployment. So staff were redeployed to kind of support their frontline colleagues. We do know that a lot of services really tried to turn around really quickly to do some of the virtual and remote consultation, which we know doesn't work for everybody. I think what I would say, as the optimist in me, what we are seeing as we're sort of, you know, we're getting over that hurdle of COVID, is that actually what a lot of services have done is taken this as an opportunity to reflect and to try and make some really positive strides forward in improving their services, because actually what it has shown to them is some of the challenges that were kind of maybe a little bit hidden to them, which they didn't sort of realize, but actually it's made them realize, you know, we've got this cohort of patients who actually virtual doesn't work for them, but we also know they're worried about coming to us. So how do we kind of make that service work for them? So I would say we're seeing some quite good innovations at the moment. We're probably not shouting very loud about them because it's early days, but we're seeing some really innovative stuff coming out, and allowing more patient choice as well. So patients are, whereas before you may have only, the choice was you have to come and see us. We do have a cohort of patients, particularly younger patients, who are now actually saying a virtual consultation works really well for me. I can take like half an hour out of work and go and find a quiet room and have a chat with somebody over virtual. So for some patients, but you know, I do agree for some patients, it has made things harder for them. Yeah.
Well, we have been lucky enough to work on the home-based care pathway in Plymouth, and that has been COVID-proof basically. And it's also freed up clinic time for those people who need a consultation face-to-face. And the nurses dealing with that service have found that they can do one-to-one telephone calls or actually visit the homes of the people. That's been a sea change, really, very good. So I know it's happening, it's just that there's a lot of people still stranded.
I think with many cases, it's just a question of having the kit and understanding the kit. And I think with younger people coming through and their parents or grandparents who are beginning to get Parkinson's, there's more of a through flow of information about how you do this, how you handle this stuff. Because if you can't turn it on, you're never going to be able to have a consultation, are you?
Yeah. And the Lee Silverman voice therapy training we heard about obviously 14 years ago. And when we came to the Southwest, it was only offered, or speech therapy is only offered during clinic hours. So, and that's very difficult for somebody to leave work, go to a clinic, get an hour's worth of shouting down a microphone and then come back to work. Whereas if it was offered virtually, that cuts down all the travelling time.
Yeah.
That's a really good point, Sue. And yeah, I think there's so many opportunities for learning from COVID, as much as the challenges have thrown up, or like where there's gaps, where there's issues. I'm going to bring us back to a research question. After all, it is a research conference, and I know that this session in particular has very little research in. So I thought, Sue, can I ask you, what do you think is the role in research in broadening the access to care?
I can talk at different levels about this. Personally, making friends with a consultant who is a researcher has been marvellous, because we get to hear about research coming online that we can access as participants. So John is now on a long-term project with a liquid levodopa that goes subcutaneously, which I don't think we'd have heard if we hadn't had that particular consultant, because she's also a PI in the study. So get involved with your consultant. Do tell them that you're interested in research projects. Have a look at the Parkinson's Join Us hub for research and get stuck in. And then at another level, we ran support groups and invited local researchers, not necessarily at consultant level, but we've got a physiotherapy team at a school at the University of Plymouth. So we invited those out, and they experimented on round shoulders and breathing depth. And that got them into meeting people with Parkinson's. So equally, we knew that we could go to their chief, their tutor, and ask more about any physiotherapy research that's going in. We found many years ago when we went to the Glasgow World Parkinson's Congress that people spoke in silos. So clinicians knew what clinicians did, researchers were doing their research, they had a nice little gadget, but they'd never met anybody with Parkinson's, and Parkinson's people didn't know what Parkinson's was. So we've spent quite a long time trying to bridge those gaps between silos. And I think that's very important.
Yeah, that's great. Oh, sorry, John, go on.
So the interaction that's taking place between researchers, clinicians, and people with Parkinson's has really changed over the last 10 years. not just because of us or the World Parkinson's Congress or anywhere else, but now people are listening to people who have the Parkinson's themselves, and they're involved in the grant applications. And Parkinson's UK, I'm waving the flag of Parkinson's UK, but it's had a knock-on effect throughout the whole system in terms of what do you want? If a person with Parkinson's cannot understand a word that's written, how on earth are they going to get involved, be the people that go and join the research projects themselves? Now, you've got to have easy access, good communication, and I think that's where a big difference has come.
Yeah.
There's also the local research interest groups that people could join. There is one here in the East Midlands, we call ours Penrig, and there's one in the north, I know there's one in the south, and people can sign up for the newsletters to find out when those research interest groups are holding their conferences, loads of different topics. It's bringing the research to people with Parkinson's who are interested, and then asking those clinicians, you know, how you're going to move it forward. So it brings education and the NHS and, you know, everybody together. And I really love sitting on the Penrig group because it really, yeah, they've got their next conference coming up in the next few days. So, yeah. I think I'd encourage people to join their local research interest group as well.
A virtual meeting.
We hold virtual meetings now. It's not stopped us. In fact, it's made things, you know, really easy in terms of, you know, all meeting together on the same day, because geographically we don't have to book a space out and all travel there. We can just meet on Zoom, which is great.
We started Penprig, so that's Peninsula Parkinson's Research Interest Group. We have a Facebook page and we have a website. On the website, there are the talks that have been given to the group. And that works very well, but of course people have got to go and find it.
Yes, I know about it.
Yeah,
exactly.
Who actually comes out to meet. Can I just say a word about a personal thing at the research level? Is that it's quite daunting to think you're going into research and you might just get the placebo for 2 years. But I was reminded by our consultant that once you're in a research project, you actually get a lot more medical support and you get to know the team much better. So John has found out umpteen things about his body, what he's lacking and what he's not doing and all the rest of it. But we wouldn't have found that out from an ordinary consultation, whether it's virtual or not. Nobody tests for vitamin B levels unless you ask somebody to test for vitamin B levels. Yeah. Nobody finds out your feet are numb until somebody tests for it. So getting involved, even if you're in the placebo arm, is much better than not being involved at all.
Yeah, good
so
point.
This comes from the requirements from the funders. So the companies require this sort of information. They're paying for it, they get it. But it's not on the National Health Service fund.
Yeah.
And that makes a big difference.
Yeah. Sue and John, I would love you to come and talk to. So we do an induction program for new nurses. I would love you to come and talk to them, because actually we talk to them about the importance of, you know, even if they're not researchers, they've still got a really big role to play in making sure that people with Parkinson's can get involved in research. And so, you know, that's an aside, but I think it's really great. But I actually think it's the point you raise, it's really important about people with Parkinson's asking their healthcare team about, can I get involved in research? Because it kind of demystifies research for them as well. Because, you know, for example, when we talk to our new Parkinson's nurses, they don't always understand the full how important their role is in research and getting people involved in research, and and how that can help influence services moving forward as well, and how it can change and improve services. So I think your point about if there's one take-home message, it's talk to your care team about research, and it doesn't have to be like really complicated high-level research that you get involved in.
Absolutely, there's so many tick boxes there for me. I started off with just doing filling in questionnaires.
Yeah.
So anyone can fill in a question. You do it every day in your normal life. So and now we've ended up with co-applicants on here. It's absolutely bizarre over that period of time.
Oh, and we thank you so much for being involved in all of those studies. You bring an invaluable insight into Parkinson's to the researchers as well. So we've heard a lot about how people find the professionals, the services that they need. Caroline, I was wondering if you could talk about what people can do, how people can best help these healthcare professionals to carry out their job and ultimately offer them better support. What do they need to be doing? So on the other side of the coin, when you see somebody who comes into your clinic, what are you hoping that they're going to do?
It's a very good question. It's about engaging, I think. The challenge we have is that, particularly with voice, people don't always recognise that there is a problem. So you're actually taking somebody on a journey from not thinking that there's a problem to acknowledging, aha, there's something I need to do about this. So that's where that compassion focused therapy comes in. It's about self-management. It's about, I'm going to support you, but actually you're doing the legwork here. You know, when you go home, you're the one doing the talking to everybody. I can't do that for you. You know, so we're scaffolding and supporting, and we will help problem solve, but ultimately it's about helping you do it for yourself, and building your resilience to be able to do that. So you're going to have challenges come along, and we can talk about what those challenges are, but it's down to you to make the difference for yourself.
I think Sue and John, you're on mute.
Yeah, John said he was just leaving the room.
That's too accurate for life. Thank you. Too accurate. In public, you've done it to me now.
Well, we create opportunities. I think this is what our service tries to do. So creating opportunities for singing, for example, and maintenance of voice. But it doesn't have to be held by your speech therapy team. We can work with our partners, like we've worked with our local branch in Derby, and they've had a singing group now for 8 years, 9 years running, independently of the clinic. And it's about being able to signpost, isn't it, to what's going to help. Yeah.
Brilliant.
Can I say one last thing before I disappear? Caroline, you're the first person that has ever said publicly, in my knowledge, that you can relax with really loud rock music. Fantastic. It's wonderful. Right, that's it. No more.
Excellent.
Oh dear. Catherine, I wondered, so you get an overview, this really good overview of all of the different services that are out there at the minute. Can you tell us more about like some of the changes that are going on, some of the progress that has been made, particularly by the Parkinson's Excellence Network? I just wondered whether you'd like to fill us in on how that's been going since it was launched. What was it, 5 years ago now?
5, 6, yeah, maybe a little bit longer. Yeah, I mean, so I think we have seen great strides in services. So, for example, I mean, we now have 471 Parkinson's nurses across the UK, which is from sort of 5 years ago where we had around 320. So I think we've made huge strides there. Within the Excellence Network, we are working really closely with our health and social care professionals to really support the growth and development of services, and we've got a number of priority programs. So I've already spoken a little bit about, for us, the importance of getting access to that multidisciplinary team is really important. And within that work stream, we're looking at not just we're looking at doing some work around funding some sites out there so that they can go and help us collect evidence and data and research, about why it's important for people to have access to that multidisciplinary team. We're also looking at how we can actually skill up and support therapists. So people that are, newly qualified therapists, and Caroline is really thankfully helping us with that program. So we're devising a whole sort of online education program for them to skill up that workforce. One of the big areas of work that we're really keen to do is with our workforce is not just make sure we've got a workforce that works for now, but actually we need a workforce that's fit for the future. That's what we're calling it. So we need to look at how all of these new, fantastic, enthusiastic, up and coming consultants, nurses, therapists, the wider whole care team, how can we get them into Parkinson's, into really excited and become our care team of the future? So that's just a bit of a snippet, but really sort of, we have the most fantastic Parkinson's community out there. So not just professionals, but people with Parkinson's as well. That's kind of the whole of the Excellence Network. So we kind of bring all of them together and making huge strides, not just in numbers, but innovation that's out there. We've got, I'm not spoiling anything, but we've got our Excellence Network Awards and Conference coming up after ParkOn. Some of our award winners, there's some amazing innovative projects there, which are really going to make such a difference for the lives of people with Parkinson's. So really excited.
So when it comes to actually communicating with those healthcare professionals, how do you think people should go about it, Sue? How do you think they should actually bring up a problem that they're experiencing?
I think some people leave their problems too long. So they become really serious problems before a professional gets engaged with them. And other people probably dip in too soon before they really know what the problem is. So there's a middle path where if there's a problem you can't deal with, don't wait until you've got an appointment with somebody. Actually get on the phone and say, I'm struggling with this. And if you've actually tried to do anything, tell the telephone message, because that's probably what you'll get. I've done this, I've done that, I've done the other, but still this is happening. I need some help. Please, would you get back to me?
Yeah, I think that's really important, Sue, is it's you as somebody living with a condition, know your body best, you know yourself, and you kind of know when something's not quite right. And that just, a phone call that could prevent that unnecessary admission into hospital or having to go and see your GP. Don't be afraid. And the other thing as well is people are living with Parkinson's, but don't always think everything is Parkinson's, because it could actually be something else. But actually that's something else, if you don't nip it in the bud, could have a knock-on impact on your Parkinson's. So if you're not feeling right, whoever it is, your GP, your Parkinson's nurse, like you said, if you've got access to a nurse, but yeah, get in there early. They would much prefer that 10 minutes in a phone call to you than a week in a hospital bed, I'm sure of it. Yeah.
There's also the way services are set up. They're actually set up for patient-initiated follow-ups. Yeah, so in the vast majority of services, they deal with episodes of care and will discharge people with the notion that you're going to get back in touch when you need us. Yeah, so you need to get back in touch because they are waiting for you to get back in touch. And that's exactly what you said, Sue. It's about the timing of that and people saying, oh, I don't want to bother people. But it's not bothering when we can be proactive, because we'd prefer to be proactive and prevent the fall than you have the fracture and then spend time in hospital and recuperation and, yeah.
That's wonderful, but you've still got to have the staff in place to do it.
Exactly, I know.
And that's if there's overlap between the areas or contact between the areas to get talks going in some way, that'd be brilliant. Yeah.
So we have a steering group in Derby, and that has a representative of the Parkinson's community on there. We have Parkinson's UK, but also the client voice. And that's important for designing services and keeping that at the centre of what we do. So maybe that's it. It's about the Excellence Network encouraging patient voice on steering groups.
Yeah, I would agree, Caroline. And we very much see the Excellence Network as that collaboration with professionals, people with Parkinson's and Parkinson's UK. We very much, I think sometimes we see it as a bit of a triangle, but each voice is equally as important. And actually, when we talk to a lot of services, they will sometimes say to us, how do we get to the patient voice? So actually it's them initiating and saying, we really need to get people with Parkinson's involved. You've got some great links in, how can we do that? And that for me is really encouraging, and maybe something that wasn't happening like 15 years ago when I first joined the charity. But it is almost like the first question now is, how do we get people involved? Which for me is fantastic. Yeah.
And I'm going to finish off now with one last question. So there might be people on this session right now thinking they might have something that they need to go find some support for, and maybe they don't know exactly where they need to go for that support. So where would you signpost people if they're thinking they want to take that next step, and perhaps not going to see their specialist for a while? Where would you actually signpost them to?
I don't mind kicking off. I mean, I would say is that if you are fortunate enough to have your nurse or your consultant, and going back to what I think we said in the last sort of question, is don't wait until you've got an appointment, be proactive. So if you've got access, you know, a lot of our services have helpline numbers, or where you can even leave a message or some email. Be proactive. Contact either your nurse or your consultant as your first kind of point of call. Go to your GP if necessary. You know, they might be able to kind of point you in the right direction. Fantastic Parkinson's UK helpline that you can contact, who may be able to kind of point you in the right direction. But I think it's that being proactive, not waiting, as we've said before. Yeah.
So we've heard a lot today, lots of tips of how to get into contact with people, and all the different things like research that can help people take control and find different access into those services. And also we've heard a lot about the Excellence Network, so I do hope that we've plumbed up some extra views for that. Do search it, it's on our website. You should easily be able to find out how to join in that conference as well, if you haven't had enough of conferences after this. And I'd love to say thank you to everyone for joining us and for a really good discussion. It's been really insightful, so thank you so much.
Thank you.
Thank you.
Thanks for asking.
Becky, I should have really mentioned that we've got a book. It was supposed to be published on the 1st of October, but it's actually about the multidisciplinary management of Parkinson's. And it was edited by Fiona Lindop and Dr. Skelly here from our clinic. It's got lots of different multidisciplinary team members that have inputted into the book. I don't know if you want to refer to the book or not, or...
Well, I think we can keep that in. We can refer to it right now. So there you go. That's another thing people can go and investigate. We'll put a link in the further reading section of our website. You'll find a link to that book, and also a link to the Take Part Hub that Sue mentioned earlier about how to find out about research opportunities in your area. Little postcode search there that people can put the postcode in, find an opportunity. So yeah, we'll certainly share that. Thank you so much, everyone.
Hi, I'm Liz Nash, the Research Support Network Manager at Parkinson's UK. We hope you're enjoying our ParCon event, and especially this session on making the most of your relationship with your care team. Unfortunately, our speakers aren't available today for a live Q&A, so instead, we hope you'll enjoy these messages from our campaigns team at Parkinson's UK. The campaigns team work with volunteers across the UK to build a movement to fight for a fairer benefit system and high quality health and social care. Enjoy.
Hi, I'm Grace and I'm the Campaigns and Engagement Lead here at Parkinson's UK. That basically means that I work locally and nationally with volunteers and campaigners to try to make positive changes in people with Parkinson's lives. Some of the work that my team have done that you might be familiar with are campaigns in local areas to recruit nurses to local services, or guarantee that patients can get their medication on time in hospitals. Our volunteers come to us from all walks of life and do fantastic work reaching out to local politicians and service providers, organising events and collecting petition signatures in order to make change. Our flagship Get It On Time campaign before the pandemic had nearly 20,000 signatories to its petition, and it caught the attention of the Secretary of State, who asked to meet us about tech solutions to medication issues that people were experiencing. This was thanks to the work of our campaigners who helped 19 trusts change their policies on medication management. We're not done though. We know that in the coming months and years that the NHS and social care and local communities more generally will be feeling the effects of the pandemic. We know that there is still vital research to be done towards advanced treatment and a cure. And we know that we have a medical workforce who are overburdened and under-resourced. So we want your help. If you want to get involved with our campaign work, but you don't have that much time, that's fine. Sign up to our campaign network through the link in your programme. You'll get monthly emails with small online actions that you can do for us. If you've got more time, why don't you apply to become a volunteer? You'll be able to shape and plan campaigns as a part of our team, take proactive action in your local area and help your community. If you wanted to know more, please email campaigns@parkinsons.org.uk. Thank you, and I hope you have a great rest of the day.
My name is Sam Freeman-Carney. I'm the Health Policy and Improvement Lead at Parkinson's UK. We have been collecting insights from people with Parkinson's-related dementia and their carers about their experiences of the health and social care system today, as well as gathering the views of health professionals. We found people had difficulty in getting a timely diagnosis, which is needed to access services they need to live well with Parkinson's-related dementia. There was a lack of understanding of Parkinson's and dementia among paid carers in the home and in care homes, as well as from health professionals who do not specialise or have a special interest in this area. We found people experienced poor quality care when people were admitted to hospital for a reason other than their Parkinson's or dementia, and carers told us how they were struggling to cope with a lack of support available for them. There was also little or no guidance on how to support their loved one when they were experiencing distressing hallucinations or delusions. People with Parkinson's-related dementia and their families face an uphill struggle trying to navigate the social care system in order to get the care they so desperately need. People also face challenges in trying to get funding for care, and those required to pay for their own care face catastrophic costs. We've used these findings to produce a policy report which will be launching in Parliament on the 23rd of November this year. The report contains recommendations for government and health and social care decision makers on the changes that need to happen in order to improve care and support for people with Parkinson's-related dementia. We need as many people as possible to email their MP to ask them to attend the launch of the report. It's really easy to do so. We've included a web link in your programme for ParkOn that takes you to a simple form to fill in to help write to your MP to ask them to attend. If you have any questions, please call our campaigns team on 020 7963 9349 or email campaigns@parkinsons.org.uk.